Hi everyone, Susan Brown here. I wanted to take a minute and share with you some thoughts I've had about COVID actually and public health. As I look around and I see the number of businesses that are going bankrupt, I see the great suffering of so many families that are losing their income, much less of the thousands of people who died because of this virus. It occurs to me that we could have done better, and we could have done better if we put public concern into public health. For example, we know now that vitamin D levels are directly related to your vulnerability to COVID and to the likelihood that you're going to die from COVID. We've seen this from studies around the world. People with very low vitamin D levels die from COVID much more than people who have adequate vitamin D. And the same thing is certainly true with vitamin C. In fact, we wrote about this. We wrote about the Chinese work with vitamin C. We wrote about the decades of research using high dose vitamin C for viral infections and using moderate dose vitamin C, like 4 or 5 grams, just to make you more resistant to all the flus and viruses that go around. When we wrote about that, that information was actually taken off our website, and many other websites around the country have been censored talking about nutrients that could help fortify immunity. In fact, one of my friends is a very famous homeopath. He actually runs a school of homeopathy, and he was told he could not say that vitamin D could help prevent COVID. You know, the government is trying to protect us in a sense from flim-flams, people saying the grapefruit juice is going to protect you. But on the other hand, we have failed to recognize the long-standing science, and you got to wonder what interests are behind not this whole clamping down of the information on basic nutrients that are so well documented to be antiviral and to be immune enhancing, particularly vitamin C, vitamin D, magnesium, zinc, and of course an antioxidant like selenium. These are simple things, they're not expensive. For years, we have been saying here at the Center for Better Bones, actually, that we should have universal testing of vitamin D. I've always said that would be the simplest public health effort, the least expensive way to improve public health worldwide. And now, of course, we're seeing that. If you look carefully in the literature, the years coming, we're going to see lots of correlates about different medications that weaken our immune system, about different lifestyle factors. But some simple things we could do: test people for vitamin D, make sure everyone has the vitamin C that the average chimpanzee our size would have. Remember, chimpanzees and humans don't produce vitamin C, almost every other animal does. We should consume as much as the average chimpanzee would consume. The average ape our size, which is about 3,000 or 4,000 milligrams. We should consume lots of fruits and vegetables, and couldn't the government start subsidizing fruit and vegetable farmers instead of all these dairy farmers and all of this meat, which is truly associated with a lower level of health? So what I'm thinking about, each of us has to take our responsibility to take care of ourselves, because we're the most interested party in that. Sort through the data, but look at the common sense things you can do. Get your basic nutrients, have your vitamin D tested. If you the least to get 3,000 or 4,000 milligrams of vitamin C, get the adequate magnesium, which is probably, the new research is saying 600 milligrams a day, maybe half from diet, half from supplements. Get plenty of zinc. A good multivitamin will help you, and work on public policy of educating each other and educating even our government about the fact that we want a public health that reflects the public interest and not so much reflects the interests of the big pharmaceutical companies. Those are my thoughts. I'd be happy to hear your thoughts. All of us have to work together, think together, so that we never have this situation again where so many people are vulnerable to this virus. Be well. Let's talk soon.